Earlier, children used to go out and play in the compound and have physical, real life friends. Today, children are playing on their PS2s and they are only playing on their gadgets, on their hand gadgets. Even parents find it easier to keep the child quiet and comfortable with a gadget. So this is a whole pandemic which is going on. Myopia, we are in the middle of a myopic pandemic, and by 2025, probably 1 in every 4 kids will be myopic. Encouraging our children to go out and play. Reducing the screen time for the kids, whether it is in school, whether it is doing work. Why can't they work on paper and pen? Why does a 5-year-old, 6-year-old need to work on a laptop to do their work, their school work or their school projects? Why can it not be done off the screen? So reduce the screen time for the children as much as possible. So the first thing that we would like to do is eye check, a dilated eye refraction, wherein we take out the number and make the child wear glasses. That's the first thing that is to be done. After that, we've actually been advancing in the treatment thing, just in an attempt to somehow control and the powers of the child and to make it more predictable. So we do use atropine eye drops once in the night to control myopia, and then it is also, there's enough science holding this technology, or not technology, this technique of management or control of myopia by just using atropine eye drops. And of late we've been using myopia control glasses, myopia smart glasses as they are called, in which the aim is to blur the peripheral vision of the child, so the child uses the center of the eye. And we do several different types of testings now, advanced testings, where different parameters are checked, and that is how we try to control the myopia of children. Sometimes children have powers which are unequal. So one eye may be a little high powered and the other might have a little less power. Now in this situation, we see some kids having squints, where one eye is looking straight and the other is deviated inside or outside. So when we see a squint, we have to take this child up for an eye examination. Another very, very difficult thing which happens, or a very tough thing that needs to be really kept in mind, is that if one eye is seeing well, or the eye that has the lesser eye power is the eye which predominantly starts seeing, and the eye with the higher power tends to get lazy. We are in a pandemic of myopia. Loads and loads of young adults who are going to grow older will grow older with the complications of myopia. So they will be predisposed to developing a lot of retinal diseases like holes and retinal holes, retinal breaks, retinal detachments. There will be more myopic degenerations that's going to happen, impacting vision. Also, people who have high numbers are predisposed to developing cataract earlier. So it's going to be a whole generation of people who are going to have a lot of complicated eye condition. So it is extremely important to train in, or to rein in, I will say, myopia at the very beginning when the child is small, so that we don't have to suffer with all these later in life. There is treatment available, there is awareness. All it takes is a parent to take the child to a pediatric ophthalmologist to do the needful. Yet another thing that is being done worldwide, there are specialists for it, it's called as orthokeratology. It's a little tough on the kids because contact lenses are to be placed in the night, and then the child is made to sleep with it, and the next day it is removed, and this is all with the intention that we are able to shape the cornea and thereby reduce the powers of or not let at least myopia progress. It's a bit questionable though.